COVID Conspiracies 101, Episode 5. We're going to talk about how people think hospitals are empty, and the fact that some hospitals are empty and have low volumes. That means that COVID is a hoax and is fake. So let's get into that. So first of all, we're going to talk about the reason why hospitals in more rural areas are empty. Okay? They're empty because we're all in this state of all elective cases have been canceled. Elective cases meaning your orthopedic surgeries, your plastic surgeries, your dermatology stuff, any general surgery, any OB or GYN, not OB still gotta happen, but GYN surgeries, anything that's not emergent, urgent, is on hold. So when you look at a hospital system, that's a large volume of people that are staying in the hospital, people that are post-op, people that are getting admitted for that stuff and being watched for potential, surgery. It's kind of how it works. That's the fueling, that's the gas for the fire is the OR. So when the ORs are shut down, you're losing a lot of surgeons, you're losing a lot of nurses, a lot of providers that just don't have anything to do anymore. So guess what? The hospital says, well, we're not working you right now, so we're going to go ahead and send you home. Or we're going to go ahead and cut your pay. Whatever you want to do. So a lot of these people are getting let go or furloughed, whatever you want to call it. Providers, docs, nurses, all kinds of staff in these areas that are outside of big cities that are drastically affected. So you go to these places and there's whole wings of the hospitals have been shut down. They're post-op wings. They're where people go after they have surgery. So yes, there's nobody there. And you add on top of that everybody's scared shitless to go to the hospital. So the ER, despite the pandemic, the ER is actually seeing much lower volume of everything. Whether it's chest pains, whether it's other issues, people just don't want to go to the hospital because they don't want to get COVID. So the numbers are way down across the board. And that's leading to less shifts, less coverage these places need. And on these pictures people are taking of the ERs and everything, there's nobody here, there's no COVID, blah, blah, blah. Yeah, because COVID is only in the big cities right now to a bigger degree. It's only in the bigger the city, the more saturated you are with COVID right now. So for the most part, everything outside of the big cities is slow. So, and if you're even smaller than your fifth, sixth largest city in the state, in most states, you're going to be almost empty, non-existent. Say you're the one hospital in a smaller town. The smaller towns don't really have any problems with COVID yet. So all those hospitals are just struggling with no patients, and now they shut down the few services they were pushing through there. So everything's shut down. Parking lots are empty. ERs are slow. Wings of the hospital are empty. ICUs are pretty empty. So that's why it looks that way. That gets into a whole nother issue as far as should we have slowed down and should we have put these statewide, efforts into measures in effect? I think no. I think if you didn't have any cases and you're a minimally affected area, now is the time to start opening them up. Because there's no cases there. The hospitals aren't overwhelmed. People would say, if this was real, why would providers be let go? Why would doctors be let go? Why would nurses, get let go? Because they're in areas where it's not hardcore busy. If you're trying to go to New York City or Louisiana, where they are short on manpower because of what's going on, things are improving some now, but they're offering ridiculous money to go up there because there's not enough providers. So it's not a hoax. It's just not everywhere. And it's not even it's not everywhere, it's non-existent in some areas. There's some counties, some states that have minimal cases. So of course it doesn't exist to them, because it really doesn't. It's not there yet. They should have never been shut down. We didn't have the time to figure all this out. Now we have the time. Now we need to start strategically opening these areas. It feels like a hoax to a lot of 95% of the country probably feels like it's a hoax because it's not in their city. It's not spread wide enough in the city they live in to feel like it's really there. So all they do is see it on TV and on their phones, mostly on the phones. Nobody's watching TV anymore. But that they can assume that, well, that maybe that's not right, because I don't see it. I don't know anybody that has it. I don't know anybody that's died from it. That's what people think when they live in these smaller towns or these smaller cities that really aren't hit hard, because it's not there. So you start to think this is all for nothing, when the bigger cities like New York City and Massachusetts and New Jersey and Michigan, Louisiana, all these states have really dense spots. Florida, so California. So there's very much active states. But even those, you even look at New York, the East Coast of New York is getting hammered. Worst. New York City is the worst city in the whole world with COVID. And then you look over in the rest of the state, and they did the antibody test, and only 3.6% of the rest of the state, ones they tested, were positive, as opposed to 21% in New York City. So even the worst state that we have, there's still a whole lot of people in that state, and a lot of cities, a lot of areas, majority of that state is not affected enough to really think that what's happening in New York City is legit. They think it's only there, it can't affect them. It seeps out. It's seeping out now, even with social distancing. So it's here. It's just not everywhere, because it's only hit at most, I say 5% of Americans have had this. I think it's closer to like 2%, 2 to 3%. That's it. That leaves 97% of the country has not had COVID. So we didn't make much progress. With all this talk and everything, we're still at 3%. So it hasn't changed. We're just starting with a bigger number at this point than we were 6 weeks ago. Now we got millions that have had the infection, and we're trying to figure out what to do with it. Check out my plan. I got a plan.